Good morning, Walter. We first noticed that Walter had a hearing issue when he was born. He was born deaf in his left ear, but had full hearing in his right ear. As we were seeing a pediatric audiologist locally, she said, oh, maybe it's just the terrible twos. But when we got him in the sound booth, he had lost 20 decibels of his hearing.
When Mom said kitchen to me, like, what? Are you saying catchin or ketchup?
When we found out that he was going to be profoundly deaf in both ears, I was just worried how it would affect him socially and academically.
What causes hearing loss is primarily a loss of hair cells, and the hair cells supply the information to the nerve cells in the inner ear. And what the cochlear implant does is it bypasses the hair cells and directly stimulates the hearing nerve fibers in the ear and the hearing nerve cells.
Many of the important discoveries that led to the modern-day cochlear implant were made in a small laboratory in Baker House. Nearly all the experts worldwide in auditory physiology and ear surgery thought that the development of the cochlear implant was a fool's dream. How could one have the hubris to think that you could replace this exquisite machinery of the inner ear with these crude electrical stimuli? Discovery alone is useless unless it's applied. And the application was made possible by spectacular colleagues here at Duke.
The Duke Cochlear Implant program is just fabulous. Duke's program was just hands down the best. They were the ones that made us feel the best about what was in store for Walter and what they could do for him.
You look really good. It is so nice of you to come here and see me.
I'm doing good, yeah.
Good, I'm so glad to hear it.
We did his first implant in 2009. He ended up getting a second implant about a year later in 2010.
Oh, Dr. Tucci's my favorite doctor. She's the doctor who cut my ear open and put the magnet inside and then stitch it back. And she did the same to the other ear.
All right, Walter, let's take a look in your ears, okay?
The brain has to learn how to hear. And so when Walter first was stimulated with the cochlear implant signal, he hadn't been used to hearing at that level before.
Very nice. It looks perfect.
At first, there's a lot of reprogramming to get that right.
Yeah, it was so painful. I got so mad because it was so loud.
So there's a few things we test when we test someone with a cochlear implant. We test their ability to hear sounds. We also test how soft they can understand easy words. And then we also test their understanding.
The cows are in the pasture.
The cows are in the pasture.
So it's always exciting when somebody's getting an implant turned on for the first time.
Salute the flag, the grand old flag, with colors red, white, and blue. It stands for freedom and liberty. This flag is waving for you.
He really didn't like music when he first got his cochlear implants. He would cry sometimes and say it was hurting his ears. And about a year and a half ago, he started to like music again.
I love singing.
Star, star, morning star, shoot fly, don't bother me. Shoot fly, don't bother me.
Duke Hospital holds a special place in my heart because of Walter and the cochlear implants that he received there.
I feel like the work that we do here at Duke really changes people's lives, and that we have a wonderful team of professionals that all care very deeply about our patients.
The team here in otolaryngology is like family, and we all just get along, and that is so important when you're working in an entity like Duke, and so teamwork works perfectly for us.
For a beautiful child like Walter, all of life's opportunities have been enabled for him.
I want to be a doctor because I want to help people with disabilities. Boom. The kids that are like me and Duke are cool. Oh, yeah.
Thanks to Dr. Tucci's surgery, thanks to the device, and thanks to the incredible power of the brain to utilize the input from the device. This is not a scientific term, but I think it's a miracle. It makes me so happy that you can use it and that you're hearing so well.
It makes me happy that you're a doctor.
It worked out, didn't it?